Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll-free at 1-800-522-0071. And you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we cannot see or hear you. If you have a question, please type it in the chat. At the bottom of your screen, you will see several options, one of those being chat. And if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Thanks, Rachel. Good morning, everybody. I hope folks had a great weekend and enjoyed that weather. Rachel and I were just talking about what a shell shock this morning was. I was not ready for it to be this cold again. And then turn around tomorrow, it's supposed to be very, very warm. So welcome to Oklahoma. Rachel, can you confirm, is everybody able to see my screen?
Yep, Ray, we can see your screen. It looks good. It says welcome to Medicare Mondays.
Okay, great. I wasn't quite sure if I'd flipped the right switch or not. So yay. It's been a while, folks. Okay, so let's go ahead and get started. Wanted to remind everybody that our welcome to or Medicare Mondays is brought to us by our grants, which are funded by the Administration for Community Living, that gives us funds to go out and educate folks about Medicare and the different parts of Medicare and how to make the most out of your Medicare coverage. So please, if you've got any questions about your Medicare, or any problems that you may be having with your Medicare, or concerns about Medicare fraud or how to pay for your Medicare coverage, please don't hesitate to give us a call, and we'd be happy to see what we can do to give you some assistance there. So our topic for today, before we get to that, one last reminder, folks. The Medicare Advantage open enrollment period ends at the end of March. If you are currently enrolled in a Medicare Advantage plan, and you would like to see if maybe there's a different Medicare Advantage plan that you would like to maybe change to, or if you've changed your mind and maybe you don't want to be in a Medicare Advantage plan and would like to revert back to original Medicare and pick up a Part D plan, your opportunity to make a change closes at the end of this month. So if you are interested in making that change, you can give us a call and we can help you compare your current coverage to the other plans that are available out there. However, now we can't enroll you in a new plan. You would have to call either the plan that you're interested in enrolling in, or you can call the people at CMS at 1-800-MEDICARE to make that change. Or you can talk to a licensed agent here in Oklahoma if you want to make that change. But we can help you talk about what that change would look like. The other thing that you want to make sure of before you make any kind of change with your Medicare Advantage plan is making sure that any of the providers that you currently see, do they accept that new coverage? So if you're talking about making a change to a different plan, make sure that the doctors or hospitals that you need to go to, that they would accept that new plan that you're thinking about changing to. Also, you want to make sure that any prescription medications that you take would be covered on the formulary for that new plan. So just don't hop on a new plan because your best friend said it was a great plan or because they liked it or anything like that. There's a lot of things to consider before you make a switch. But if you are thinking about making that switch, your deadline to do so is the end of this month. So keep that in mind. But let's go ahead and get started on our topic for this month, which is Medicare appeals. And this is an important topic because a lot of times people don't know what to do if they've had some kind of medical service that's been provided to them and for some reason that doesn't get paid for. Somebody says, oh, wait, that's not a covered benefit, or you didn't get the proper authorizations first, or something like that. And they feel at a loss. They don't know what they're supposed to do in those situations. So we're going to talk about what you as a beneficiary can do under those circumstances to look for some guidance on what you can do. Now we're going to talk about this today in relationship to original Medicare, to traditional Medicare. But these same rights exist whether you're talking about original Medicare or a Medicare Advantage plan, one of those HMOs or those PPOs, or even if we're talking about your prescription drug benefit. So you've got these appeal rights regardless of what area of Medicare we're talking about. So when we're talking about a Medicare appeal, we're talking about a formal request that beneficiaries can make to Medicare if they disagree with a denial that was made. So someone, maybe they went out and they received some sort of coverage. They sought a service, they had an operation, they got some sort of medical treatment, and then that treatment was denied. The payment for that treatment was denied for whatever reason. Now, there are two types of Medicare appeals. The first one is the standard appeal. That's where you've gone out, you've had some sort of service that's been provided to you, and then you receive a notification that says, we're not going to pay for that. The second one is an expedited appeal, and that's a situation where the care may be ending too soon. In other words, you're still receiving that treatment. Maybe you're in the hospital and you're receiving a notification that says you're about to be discharged from the hospital or skilled nursing facility. We'll talk about that in a moment. So we're going to start with the original one, the first one that's just talking about a standard appeal. Now, this all starts with the documentation. The first document we're going to talk about is the Medicare Summary Notice. This is where a beneficiary has received treatment through original Medicare. This is the document that identifies all the services that have been received by someone who is on traditional Medicare. It tells you what the services were, who provided the services, the name of the provider, where they're located, what the services were, what the charges were for those services, etc. This is not a bill. This is not something that you're going to send a payment to that address for those services. This is just documentation from Medicare to say that Medicare received a bill. And this is the first thing that you need if you're going to have to file some kind of an appeal. This is the documentation that sort of starts the clock. It's a summary of all the services that have been received by a beneficiary. So whether we're talking about a service that was provided at a doctor's office or at a hospital or maybe at a physical therapy location, your Medicare summary notice is going to outline what those services were. It's going to tell you who the provider was, and it'll tell you if Medicare has paid that provider, how much that provider received, how much money that provider received. It's also going to tell you if there's some money that you have to pay. As you know, let's say we're talking about Medicare Part B, there is a deductible for the services that you receive through Part B. And then after you've met that deductible, Medicare, traditional Medicare, pays approximately 80% of the services, and you're responsible for approximately 20% of those services. So it will tell you if there's something that's left over that you need to pay for those services. It will also tell you if Medicare has denied payment to that provider for whatever reason. Maybe they're saying this is not a covered benefit under your Medicare, or it didn't meet the requirements to be paid by Medicare. So this is a very important document for you to pay attention to, because in addition to telling you whether something's been paid and how much it was paid, it'll tell you if it's been denied. And if it has been denied, it will tell you why it was denied. And if it was denied, it has to tell you the reasons that it was denied for. either for lack of documentation or it wasn't a covered benefit or something like that. Now, there are two different Medicare summary notices. You'll get one Medicare summary notice for services that you receive under your Medicare Part A, which is sort of the inpatient services, and your Medicare Part B, which is kind of the outpatient stuff, the medical services, as they say, which is kind of your doctor's offices and ER services, things like that. Now, there's a big change that is taking place in 2026 that you need to be aware of. If you're somebody that has been getting your Medicare summary notices through the mail, you need to be aware of this. This is very, very important. The Medicare summary notices that come in the mail have historically been coming out on a quarterly basis. They come every 3 months. That's going to change this year. And this was done very, very quietly. Most people are still unaware of this. Those are now going to be mailed out every 180 days instead of every 90 days. So that's a big difference. It's going to be out twice as long as what it used to be. So that's a long time to wait to hear whether or not a service has been paid or not paid, or whether it's been denied. Now, that's not going to impact the time frame within which you've got to file an appeal. It's not going to shorten the amount of time you've got to file that appeal. The appeal time frame is based on when you've been notified of a denial. So you'll still have the same number of days to file that appeal. We'll talk about those time frames here in a second. But it will push out the amount of time before you even know that something has been denied. So that's kind of a hassle. So if you are someone who is still currently getting your Medicare summary notices in the mail, you need to be aware of this. It's going to change how soon you hear about things, about when they've been paid or when things have been denied. Now, you should also be aware, if you haven't already heard this, and we've talked about this before in previous Medicare Mondays, you can, if you have not already done so, you can sign up for a Medicare.gov account. That's where you go on Medicare.gov and you sign up for your own little account there, and you get a username and a password. And this is an area where you can keep abreast of all the current changes that are taking place with Medicare. You can keep track of your prescriptions. You can watch for the latest fraud scams and things like that. This is where you can actually keep track of any claims that have been submitted to Medicare on your behalf and whether or not they've been paid in real time. So rather than having to wait until that Medicare summary notice comes out now every 180 days, you can actually see claims as soon as they've been paid. So if you've been delaying and you haven't signed up for a Medicare.gov account because you didn't want to or for whatever reason, now might be a good time to reconsider that. If you're someone that doesn't use a computer, if you don't want to or whatever the reason is, if maybe you've got a family member or somebody that helps you out with this kind of stuff and you want to have them help you do that, that's fine. Go right ahead. But don't just let anybody sign you up for a Medicare.gov account. Make sure that it is somebody that you know very, very well and somebody you trust. Just because your insurance agent that you might have used one time to help you sign up for your Medicare Advantage plan or something like that, that doesn't necessarily mean you want them having access to all of your Medicare.gov information. Okay? Make sure it's like a family member or somebody like that that you really, really know and trust. All right, so let's get back to talking about appeals. So with an original standard appeal, here's kind of how the process flows. The Medicare beneficiary files a standard appeal if you've already received your care. So this is something that's going to happen after the fact. You've received this care, and now you've received this Medicare summary notice with a coverage denial note. In other words, it says, this is the service you received. Was the care approved? No. So when it says no, it's going to have a little footnote number over to the side, and it'll go down to the bottom, and it'll tell you why it was denied. Also in that Medicare summary notice, there is going to be an entire page that talks about the instructions on how to file an appeal. They're very, very easy to follow. They're very, very clear. So don't feel like you've got to memorize anything we talk about today. Every single Medicare summary notice contains those instructions on how to file an appeal. And at every stage of the appeal process, there are 5 different levels of every appeal. They will have other instructions on how to file that appeal that are very easy to follow. So I want you to know that you can rest assured that you're going to be able to walk through that process as you go through any appeal process with Medicare. But we're going to go through those just so that you kind of know what they look like. Now, before filing any appeal, of course, you've already received the services. The provider submits the claim to Medicare for that care that you've received. The beneficiary then is going to receive that Medicare summary notice that says that it's been denied, and it's going to have that information about how you file that appeal. You have 120 days from the date of denial notice. So there'll be a date on that Medicare summary notice. You've got 120 days. That's a long time to file that appeal. Folks, don't wait until the 100th day. Get on it. As soon as you know that's been denied, that's the time to start the process. Please don't be one of those people that waits till the very last minute and then expects everybody else to panic. That's not the way it's going to work, because they're not going to do that. You need to get started immediately. Part of the process is going to be you're going to want to gather information. You're going to want to gather supporting documentation that supports why you think this should have been paid. You're going to want to get information from the doctor, or from the provider. Maybe this was for an ambulance ride or something like that. So you're going to want to get information from the ambulance provider as to why this was an emergency and it should have been paid by Medicare. So be sure that you get all of that information. Now, the first level of the appeal is called a redetermination. It's called a redetermination because the appeal information is going right back to the people that first denied it. You're asking them, hey, take another look. I want you to check this out again because I think you should have paid this to begin with. So the Medicare administrative contractor, that's the people that look at the claim to begin with, they're going to review that information again and see if maybe they made a mistake. They should issue a decision within 60 days. Those administrative contractor companies are contracted by Medicare for this very purpose. They're supposed to look at these claims, determine if they should have been paid and at what rate. There's 2 possible outcomes here. If they say, yeah, we should have paid this, they pay it. There's no questions asked. It goes from there. However, if they still say, no, we agree with our first decision, we don't think this should have been paid, the beneficiary can then move on to the next level of the appeal process. The second level of the appeal is a reconsideration. Reconsiderations are done by the qualified independent contractor. Now, again, as I said earlier, all of this information will be contained in the denial from that first level of appeal. If the first level of appeal by the MAC, if they say, no, we're still going to go ahead and deny this. However, you still have the right to take it to the next level of the appeal. And here's how you file that next level of appeal. So it'll have all those instructions there for you. You have to 180 days of receiving that unfavorable determination to file that second level of appeal. Okay, so again, it'll tell you what you need to do. Maybe you can gather some more information to file that appeal. They should give you a decision within 60 days. It shouldn't be too problematic there. Again, 2 possible outcomes. If they say, no, this should have been paid to begin with, the Medicare has to pay it. They can't go back and say, no, we disagree. We don't want to pay this. No, if the QIC says it should have been paid, it gets paid. However, if the QI says, no, we still uphold the denial, then you can move to the next level of appeal. The next level of appeal is an administrative law judge hearing. Now, to go to this level, you've got to do it within 60 days of receiving the unfavorable reconsideration notice. Now, the reason why this is only 60 days and all the others were longer, The logic behind this is by the time you get to that second level of appeal, you should have gathered all the documentation you need. There shouldn't be anything else out there paperwork wise that you still need to get. It's just a matter of getting this information to the right people. So you turn in a written request to the Office of Medicare Hearings and Appeals. CMS will request, you can do that on a CMS request for medical hearing form, or you can turn in a request of your own, in your own handwriting. To qualify for this administrative law judge hearing, the amount in controversy has to be equal to or greater than $190 in value. It can't be for a $20 claim or something like that. The cost we're talking about here has to be at least $190 or more. The administrative law judge receives the request and they set a time and place for the hearing, and they notify the beneficiary of the hearing 20 days prior to the date that's been set. The beneficiary can attend the hearing, and the ALJ, the administrative law judge, notifies the beneficiary of the decision by mail. They should issue that decision within 90 days of the hearing. There's three possible outcomes in this situation. Either it's a favorable decision and the claim gets paid, an unfavorable decision, in other words, they uphold the denial, or the ALJ just doesn't respond. If the ALJ doesn't respond within that 90-day period, it automatically can go to the next level, which is a Medicare Appeals Council. Under this situation, the beneficiary can request a MAC, a Medicare Appeals Council review within 60 days of receiving that unfavorable ALJ decision or the non-response. They review the appeal decision and they should issue a response within 90 days. Again, there can be three outcomes: the favorable decision, the unfavorable decision, or again, the Medicare Appeals Council may not respond, in which case you can automatically qualify to go to the next level, which is a judicial review at a federal district court. To qualify for the federal district court level of appeal, it has to be at a value of greater than or equal to $1,900. Now, once you get to this level 5, this is the highest level of appeal. The review, there's no time frame for a decision. There's possibility of two outcomes here, because like I said, this is the highest level. There's a favorable decision where it gets paid, or if there's an unfavorable decision, the beneficiary will have to pay for the service or the item. That's it. That's the highest level. Okay. Now, if we were talking, this is original Medicare. If we were talking about a Medicare Advantage plan, all of these steps are exactly the same. The only difference is instead of talking about a Medicare summary notice as the document that starts the time clock, we would be talking about the explanation of benefits from the MA plan. It's just a difference in the two documents that starts the clock. Okay? So all the steps are the same, as well as the requirement that each one of those documents that you receive at each one of those steps gives you very full and clear directions on what your next level is and what the steps are to get there. Now, the next one that I want to talk about is the expedited appeal. The expedited appeal is an appeal that happens if you're in the hospital or a skilled nursing facility or some other inpatient setting, and suddenly they're saying that it's time for you to be discharged, and you think you're being discharged too quickly. All right? This sometimes happens if you're in the hospital, you've been there for a few days, the hospital comes in and they say, okay, well, we're going to discharge you tomorrow. And you don't think it's time for you to go home yet. Or maybe you're there with your family member and they're saying, okay, well, we're going to send mom home tomorrow. And you think, whoa, that's way too early. You can actually request an expedited appeal. Now, so what happens is before the person is actually discharged from the hospital, they're going to receive something from the hospital that is called the message from Medicare. It's called, I meant to put the name of it in here, but there's this message that says an important message from Medicare. that talks about your rights to be in the hospital, as well as your rights to file an appeal if you feel like you're being asked to leave the hospital too quickly, and what those rights are and how you file for that appeal. So the hospital is required to let you know that they are going to discharge you at least 24 to 48 hours before they discharge you. When that happens, they have to notify you and they have to tell you, if you disagree with this, that you have the right to contact the Beneficiary and Family Centered Care Quality Improvement Organization, the BFCCQIO, for your state by a certain date. You contact them. They've got an 800 number, and I'll show you what that number looks like, who the QIO is for Oklahoma. And you say, I want to file an appeal. I think they're discharging me or my mom, whatever, too soon. The QIO notifies the hospital or the skilled nursing facility and says, everything's put on hold while we do a review to see if this person is being discharged too soon. The hospital will then review the information, they'll review the notes and the diagnosis and all this other stuff. If they agree with the patient, if they feel like the patient needs to stay there, then they will notify the hospital as well as notifying Medicare. Medicare continues to pay and the patient stays in the hospital. If, however, they agree with the hospital and everybody that the patient is ready to go home, then they say, no, we agree with them, and the patient can be discharged. All right. Now, this is the QIO redetermination level that we just kind of talked about very quickly. The beneficiary discusses the case over the phone with that QIO representative. The QIO determines whether that care should be continued. And like I said, there's the two outcomes. If it's favorable to the patient, the hospital will continue providing care and Medicare will continue paying for it. If it's unfavorable, the beneficiary can choose to stay in the hospital. However, Medicare doesn't continue paying. They more or less become private pay. They can choose to file an appeal. And if that appeal is successful at the next level, then Medicare would be required to pay for it. We'll talk about that in a second. Before we go to that discussion of the next level of appeal, I did want to make you aware the current QIO for Oklahoma is Acentra Health. This is the phone number. We're in Region 6, and that is our phone number, 888-315-0636. That is the phone number for Acentra Health. This is also the same people that you call anytime you have a quality of care concern related to original Medicare, whether that's inpatient, hospitalization, or outpatient. But if you've got a loved one that's in the hospital and you think they're being discharged too soon, that's the phone number. You don't have to memorize this. You don't even have to write it down because it would be on the document that the hospital would give you anytime they're discharging somebody. Now, the level 2 QIC reconsideration would be where the beneficiary can then contact the QIC by noon, and that would be a qualified independent contractor. They have to do it by noon of the day after they receive the unfavorable decision by the QIO that they got the day before. The QIC notifies the hospital and the QIO of the beneficiary's decision to appeal, and it just follows through. And I see I'm running low on time, so I'm kind of pushing through these a little bit quicker. The QIC will review the appeal and decides whether the care should be continued, and they should have that decision within 72 hours. Again, the patient can still be in the hospital, but there's no guarantee that Medicare will continue paying. Once Acentra has made their decision, there's no guarantee that Medicare will continue paying unless at one of these other levels of appeals, it gets overturned and they decide that yes, Medicare should have paid. So like we said, there can be these different levels. Once we get past that second level of appeal, the appeal process becomes just like the appeal process that we talked about earlier, where it goes to the administrative law judge, the MAC review, and the judicial review. So tips to remember when you're filing an appeal: follow the instructions. Don't jump the fence. If you're trying to follow an appeal, if you start trying to skip around or you start trying to call everybody and their dog, you're going to mess up your appeal. Appeals from beneficiaries are processed faster. So if you are the beneficiary, uh, that's the fastest way to file an appeal. Stick to the important appeals deadlines. Like I said, if it says it's a 120-day process, the sooner you get it turned in, the sooner it will get processed. Keep copies of all of your originals, folks. Don't mail the originals. All right? Keep the originals, mail copies of everything. Okay? Keep records of all the dates you mail everything. Keep very, 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 very good records of everything that you send, names of people you talk to, agencies that you talk to. The more documentation you've got, the better off you are. Get your doctors and the healthcare providers. Get supporting documentation from them and their information in the appeals process. The more the merrier, the more documentation you've got. And once again, keep the originals, mail the copies of everything that you've got, and keep everything organized. And don't give up. Keep going. Keep going. I don't want to speak ill of anybody, but I can't tell you the number of times that when we were working with beneficiaries, they shared with me that they just sometimes got the feeling that people just felt like they were hoping that people would give up. So don't. Keep working at it. Here's some resources that you should be aware of. And in your Medicare and You handbook that everybody gets every year, some of you may be getting them electronically now. That's fine. It's the same handbook that everybody gets hard copy if you're still getting those in the mail. Pages 97 through 102 shares information about filing appeals. On the website, medicare.gov, here's the link that talks about appeals, or you can just Google Medicare appeals, and there's information about this. There's our phone number at the Medicare Assistance Program. If you want to call and talk to one of us about the appeals process, we're happy to help you with any information. Folks, you don't have to accept no. If you feel like this is something that should have been covered, then yes, it can be. Now, if it's something that was not a covered benefit, just yelling at people isn't going to change anything. If it's something that was not a benefit, if they've got documentation that says it wasn't, just nagging people isn't going to change reality. I can tell you that from experience. But if it was a covered benefit, if it's something that you were entitled to and that you earned, I encourage you, keep after them. Stick with it, and we will do everything we can to help you as well. Now, these are the names and addresses of our partners across the state that if you'd like to communicate with them and work with them, just so you've got somebody closer to home to help you with that stuff. These people have all been trained and can also assist you if you'd like to speak with one of them, or you can call us here in Oklahoma City and we're happy to help you. And Rachel, do we have any questions?
We do not have any questions, which is perfect because we're a little bit over on time. And just a friendly reminder that all of our videos are available on demand on our website. That's map@oid.ok.gov. And if you want to watch any of the videos like the one from today, you can see it under the Educational Videos tab.
Okay. Folks, I really appreciate you joining us again, and I hope that you can join us again next month. And hope everybody has a great week. Thank you.